Hey everyone, this is Jennifer Burns, Module 8, demonstrating sub-Q insulin and IV push Lasix. And what you don't know is that this is my third video, so third time's a charm. They didn't seem to want to upload in Canvas when I did the record media option, so some of my supplies do look a bit used. Again, this is my third time, so third time's a charm, yay. All right, so working on IV push and sub-Q insulin. This is for Millie Larson. I am going to look at my MAR to see what medications I need to pull from the armory or the med cart or machine. I'm going to look at her name, her date of birth, and see if she has any allergies. I see that she is due for Lasix 20 milligrams via IV push every 12 hours to be administered over 2 minutes, flushing with saline before and after administration. Also due for insulin Lispro, 10 units sub-Q with breakfast for type 1 diabetes. All right, so I've looked at my MAR. Now I'm going to get my medications, pulling the IV Lasix first, or the Lasix vial. I'm going to see and compare to the MAR. This is a 10 ml vial, 100 milligrams, 10 milligrams per ml. I am looking at the expiration date and comparing it to my MAR. Same thing with the insulin. I'm going to pull insulin, confirm it is insulin Lispro. This is a 10 ml vial, 100 units per ml. Confirm the expiration date. All right. I'm going to do it for a second time. Lasix. Check the expiration. Compare it to the MAR. I'm going to do the same for the insulin Lispro. Check the expiration. Compare it to the MAR. Okay. I'm going to cleanse my hands with either an alcohol-based hand rub or soap and water. I'm going to gather my supplies. I have a Sharpie marker to label my paper tape for my syringes. I have my insulin syringe. This is a 29 gauge syringe. It is a 1/2 inch. Then I have my IV push syringe and the hypodermic needle that goes with it to draw the Lasix out of the vial. This is a 25 gauge 5 8/4 or 5 8-inch length needle. All right, I have alcohol pads, and then I have saline syringes. All right, so before I start to pull my medication from the vial, I'm going to again check it against the MAR. This will be the third time that I have checked against the MAR before I prepare. All right, so I have Lasix. Check the expiration. Compare it to the MAR. Do the same with insulin Lispro. Check the expiration. Compare it to the MAR. These are supposed to be new vials. So what I would do is I would pop the top. I would still clean the vial, even if the vial is new. I'm going to draw up the Lasix first. Clean the top. I have already done my math conversion, so I'm going to be drawing 2 mLs. Okay. I'm going to insert the syringe into the needle. Okay. I'm going to draw 2 mLs of air. I'm going to inject the needle into the vial, instill the air into the vial, and then draw up the medication I need. I would use a bigger needle, but I used them all earlier in my practice kit. I didn't anticipate making 3 videos because they wouldn't upload into Canvas, but it's okay. Just more practice. All right, so pull 2 mLs of Lasix. All right. Now that I'm done with the needle, I am going to activate the safety. I'm going to take the needle off and dispose of it into my sharps. All right, now I'm going to drop the insulin. This is going to be 10 units of insulin Lispro. Going to draw up my air. Okay. Let me clean the top first. I'm gonna pop the top on the insulin. I'm going to clean it. Cleaning the top for 10 seconds. All right, now I'm going to insert the needle into the vial, insert the air, draw up my insulin. All right, once I am done drawing up my insulin, I would have a second nurse check behind me to make sure that this is 10 units of insulin. All right. Now, what I'm going to do is I'm going to label my medication. So this is the insulin. All right. And then label my Lasix. All right. Now that everything is ready, I'm going to go into Miss Larson's room and introduce myself. Hi, Miss Larson. This is Jennifer. I'm going to be your RN for this morning, for today. But I hope you're having a good morning, and I hope you enjoy breakfast. I am here to give you some medications. I have Lasix 20 milligrams. It's going to be administered via IV push. This is given every 12 hours. I'm going to infuse it into your IV in your left arm for 2 minutes. I'm going to flush with saline before and after the administration. This is used for the edema that you're having and for your blood pressure. Also, I'm going to administer insulin Lispro, 10 units. It's going to be given sub-Q with your breakfast here. And this is for your type 1 diabetes to help control your blood sugar. Do you have a preference for where you want the insulin Lispro given? In the belly. Okay, I will get that done. Give me just a moment. I'm going to sanitize my hands. Excuse me. All right, I'm going to provide privacy. I am going to put my gloves on. I'm going to let her know that I'm pulling up her gown and pulling down the blanket so that I can administer the insulin. I would take care to look at the side it was previously given. Was it in the right side, the left side of the abdomen? Was it in the arm and the leg? So that way we can rotate sites. I would not administer this within 2 inches of the belly button. All right, so I'm going to clean the site in a circular motion. for 5 to 10 seconds. All right. With my finger and my index, with my thumb and my index finger, I'm going to hold the syringe and I'm going to use a darting motion. All right. I have let the alcohol dry, and I would let her know that I'm going to inject. Miss Larson, are you ready? I'm going to inject your insulin. Here we go. All right, 1, 2, 3. Okay, now that I have injected, I'm going to infuse the insulin. I'm going to leave the syringe in place for just a few seconds to make sure that the insulin has been administered. In a very smooth motion, I'm going to pull the needle out. I'm going to activate the safety and dispose of my syringe. I don't know where Belly went. I would pull her gown down, pull the covers back up, and provide privacy. I do now realize, as I've already done that, I did not check her, I did not ask her to state her name, date of birth, and allergies, while also double checking the MAR and her name band. So I understand that is a mistake. I should have asked her to do that. You would think that after 3 times I would be able to do that. But anyway, now I'm going to administer the IV push. I'm going to make sure I sanitize my hands yet again after degloving and administering the insulin. All right, so sanitized. Got my gloves on. Before I administer the Lasix, I am going to assess the IV site. I'm looking for any redness, tenderness, warmth, swelling, looking for any coolness to touch, any other increased edema or abnormalities to the site. All right, so I'm going to clean the catheter with alcohol for 5 to 10 seconds. I'm going to make sure all clamps are unclamped. All right, I'm going to put the saline onto the catheter. I'm going to very gently pull back on the plunger to aspirate the catheter and see if there is any blood return in the IV line. I do see blood, so now I'm going to flush with my 3 mLs of saline. I'm going to use a push-pause motion. Okay, now I'm going to inject my IV Lasix, my IV push Lasix. I'm going to administer this over 2 minutes. Now, for the sake of time, I will not spend 2 minutes doing this, but by doing it over 2 minutes, you decrease the risk of drug toxicity. But even still, while I'm administering this, I will monitor Miss Larson for any symptoms or adverse reactions of toxicity. Even if I do it over 2 minutes, I still want to be monitoring for any reactions. All right, so I've administered it over 2 minutes, again using a slow push pause kind of motion. I'm now going to flush with my remaining 3 cc's or 3 mLs of saline, again using a push pause just to clear the line, make sure there's no occlusion. All right, I'm going to place Miss Larson in a position of comfort and assess her for any other needs. I'm going to deglove and clean up my mess. I'm going to perform hand hygiene. And then I am going to document on my MAR what I've done. So I've initialed that the Lasix and the insulin were given. All right. I've documented here that the IV site was within normal limits. It was in the left arm. And then the insulin was given in the right lower quadrant of the abdomen, but not within 2 inches of the umbilicus. And then I've signed and dated the MAR at the bottom. All right. Hopefully this will upload. Thanks. Bye.